Organizations have been forced to change their procedures amid the coronavirus pandemic. And joining us now to share how the nonprofit group serving seniors is adjusting is President and CEO Paul Downey. Good morning.
Good morning, Allie.
So I said, okay, so everything is closed down for you guys, the senior centers. Tell me what you guys are doing now to continue to help seniors.
Well, we had to close we have 15 senior centers throughout San Diego. So we've closed those for the obvious reasons. We are still providing to-go meals out of our Gary and Mary West Senior Wellness Center downtown, mainly for our homeless clients so they can still get meals. But we've had to convert everything else to home-delivered meals, which we were doing, but we've quadrupled the number of meals we've served in just the last 2 weeks.
Wow, and you said that your phones have been ringing off the hook because you've opened this up to anybody who is a senior. Tell me what you guys are doing to try to continue to help seniors.
Well, on KUSI, I ran a story the other evening, and we were literally getting hundreds of phone calls an hour from people wanting home-delivered meals. And so we've hit our capacity with our current kitchen situation, but we are working very hard to be able to expand it. So we're doing about 4,000 meals a day going out across San Diego County. I'm hoping by April 1st we'll be able to expand that by another 3,000 to 7, and keep, probably another 3,000 after that as we go forward. But the challenge is that no matter how hard we work, there still is increased demand and need out there in the San Diego community.
How can people help you guys now? Because you are looking for a little bit of help now in order to serve this community.
Well, I'll just put it out there in really stark terms. To meet those additional 3,000 meals, I need to raise about $50,000 a month to pay for the operations. If we're able to go up to 6,000 additional meals, that'll be $100,000. I mean, it works out to be about 50 cents a meal that we need to support it. Fortunately, the county is paying for the food, but we need to raise money to pay for all of the ancillary services. So really, the thing we need most is people's help, their donation. And they can go to our website, which is www.servingseniors.org, press the Donate Now button, and literally a 50-cent donation will pay for one meal being delivered, and really would just hope that folks would be generous and step up and help us. That's what we need the most. We do need some additional volunteers to help with some of the delivery, but right now, for us to increase the capacity and at least try to meet the need, it's really the donations.
I would imagine that you're seeing how necessary your services are, especially in this capacity right now.
Well, I mean, our services were needed before, but even more so now, because people who are 60 plus really should not be going out. I mean, none of us are really supposed to be going out with the governor's order, but people who are 60 plus are most at risk, and most of our clients have multiple chronic health conditions underlying it. So their age and health conditions, and they really shouldn't be going to the grocery store. And, something that people can do is, if you have elderly neighbors, help them out. Go to the grocery store for them, buy some of the necessities, and get it to them. Also, people who are older sometimes are isolated, so check in on your neighbors. I mean, don't keep the social distancing, but maybe go to their door and just say hello, call them. Because there's going to be an incredible loneliness. I mean, for most of us, we've got other people around us to help us through this. But if you're by yourself and have nobody, it could be particularly difficult.
Okay, so once again, if people want to donate, like you said, just a little bit will help you guys quite a bit.
So to help us out, go to our website, www.servingseniors.org, press the Donate Now. Additional, my contact information is, so if somebody wants to give me a call or email me, I'm happy to talk to them directly. But literally, a 50-cent donation on up would help us a lot right now.
Okay, very important information, Paul. Thank you so much for coming in.
Appreciate it. Thanks, Allie.
All right.